really excited to be talking about this topic today because it's basically my life's work. Learning how to be in your body without fear, especially when you live with chronic pain and chronic illness of any kind, usually comes with some kind of pain or fatigue or brain fog, which all of those things can be really scary for a multitude of reasons. So, if you are willing to participate in chat, I'll kind of ask you to throughout the webinar, the workshop, but please don't feel obligated. So if you want to share in chat, maybe what your struggles are currently around this topic, I'd love to hear from you. But again, there's no pressure with any of the questions that I'm asking. So a little bit about me. I'm Destiny. I'm a therapist in Atlanta, a mental health therapist in Atlanta, Georgia. And our licensing laws only allow us to provide therapy in the states that we're licensed in, which for me is Georgia and Florida. Originally from Connecticut, which is probably why I have Lyme disease, because that's kind of where that's like the epicenter of Lyme. Very, very, very prevalent there. So, yeah, I practice, my whole practice is with people who have chronic illness, chronic pain. I work a lot from an attachment lens and pretty much learn everything that I can about how our attachment and our nervous system is impacted by chronic illness, and also how our attachment styles and our nervous system habits, behaviors, wiring also impacts how we live with our chronic illness. So lots of lived experience and education over here as well. And I highly encourage questions throughout this. If you have any questions, feel free to put them in the chat and I'll answer them. And just keep in mind that while I am a therapist, this is just for educational purposes. I'm not your therapist. I don't know your particular circumstances. And if I do have any clients that happen to join this, I obviously do know their circumstances, but this is a public workshop. And this is me acting as an educator and not a therapist. So by the end of this webinar, you should have an introductory level understanding of how, why, and when the body feels pain. We'll talk about kind of how to work through normal, natural fears and anxieties and kind of give a framework for what to think about when building your medical team, which is really important in helping our bodies feel safe and trusting. And then some practices that also you can use to help identify pain triggers and reduce your fear of pain. I wouldn't expect to walk away from this webinar feeling like you've achieved all 4 of these items. This is just kind of, again, an intro level understanding to some of this. And then if you are working with a therapist or a mentor or someone who you work closely with on your struggles with chronic illness, you can bring some of the insights you learn here and ask more questions, do more research. That's really the point of this. We want to just keep being curious about our bodies and curious about what we know and what we don't know. So, why do we care? Why do we care about facing our fears with our body? And for me, the main reasons are because when I care and when I face these fears, I'm more calm, I'm more connected to myself and to my loved ones, my family, my friends, my clients. I think it also helps us find meaning and purpose to care about hard things. And your pain story is really important. So I want you to consider these questions as we go through this workshop. And even right now, take a moment to kind of just think about when you first started noticing something was off or wrong. For some people, this is the day they got their diagnosis. It feels like it kind of happened overnight. For other people, it's been a lifelong journey, whether there was a diagnosis from birth, or maybe there were just a lot of experiences in childhood that just felt like they weren't normal, but everyone kind of dismissed them or didn't really pay much mind. No one had answers. And so that can sometimes be the hardest thing because you you feel like something's wrong, but everyone in your whole life has told you that there is nothing wrong. And that brings about its whole bunch of issues on its own. So also, I would I just had a text that somebody can't get into the room. So give me 1 second, because I want everyone to be able to join. All right. So when you did first start noticing what was wrong, again, you might not have had words for it when you were younger. Who supported you during that time? Who made you feel supported, and who maybe was not so supportive? And the reason why we want to think about these people and how we felt around them is because this impacts how we view our own pain and how we view our own story. So this is just about reflection. It's not about blame or figuring anything out per se. We really, again, just want to stay curious, because curiosity is the thing that eventually leads us to answers. Keep in mind throughout this as well, pain is inherently protective and it serves a purpose. Sometimes people like to phrase this as pain tells you that something is wrong. And that is a narrative that I do want to challenge. It might mean that something's wrong, but it doesn't mean it's permanently wrong always. And it doesn't always mean that something has to be done right now in this moment to fix it. You know, we can get really worked up over the concept of there's something wrong here. That feels really scary and really dangerous and can really lead us to really, really dark thoughts and places. So sometimes, you know, again, so it's not, there is no one right answer. Sometimes it does mean something is inherently wrong. I mean, think about appendicitis. You know, someone has pain happening, then intense pain, and then more intense pain and more intense pain. Like that is an emergency situation. Emily, you asked, do you mean the debilitating pain, or when did you first notice the lesser pains? Good question. Typically, I think we kind of start to notice the lesser pains, but we kind of dismiss them a lot, especially if people around us are dismissing them. So typically the debilitating pain is the thing that brings us into, makes us go see a doctor or makes someone take us seriously, or it's like we finally are maybe getting the start of getting answers, that debilitating pain, but usually we knew something was wrong before that, whether people believed us or not. So keep in mind, when it comes to danger signals in the body, we can easily misinterpret them until we learn our body's language. Again, there's really no right or wrong. This is a really individualized process, which is why we have to learn our body really well inside and out, because a pain that you're having, for example, with the appendix example, having appendicitis, with appendicitis, you may or may not, I apologize, I got distracted there. So with pain side, it might be appendicitis. It might also be indigestion. Like we don't know. And when you tune into your body without judgment, without criticism, and with lessened fear is okay. We can get to that. There's nuance there. But if fear is the predominant thing happening, typically we can't think straight. All we think is, oh no, this pain is the worst pain I've ever felt. Like it can easily turn into something that it's not. And so we don't want to stop trusting our body. We want to trust our body, but we have to listen to it in order to do that. And a lot of us don't know how to do that because we weren't taught. Growing up, a lot of us were taught to dismiss the pain, not talk about the pain, all of that. So an example of kind of getting close enough to our pain, but not too close, is think about if you're ever at a restaurant or at a park and you kind of see somebody having a conversation and they're too far away for you to hear, but they look really angry. And so you kind of are like, whoa, they're having a fight over there. They're really angry, or that one person is really angry in this conversation. And then a couple minutes later passes and you realize that they're now laughing. So as you can start to think about what might be happening, maybe they were telling a story about something else and they were mimicking someone's anger. And now they found something funny in that story. Like there's so much we didn't know, but initially all we thought was, whoa, they're really angry. And they're too far away for you to hear, right? So that's kind of similar to when we are dismissive of our own pain or critical of our own pain, or, we kind of avoid it and like try to shove it down and not feel it. That's the same example. It's hard to interpret what's happening when we're constantly pushing it far away. At the same time, if that couple at the table was right here, an inch away from your face, having this conversation, you probably also wouldn't be able to really understand what they were saying because they're right in your face, and that's very disturbing and distracting, and it's too much. So same thing with our pain. If it's all we're thinking about and it's all right here and we can't find any space from it, we're also not going to be able to really understand the signals that it's giving. So we might misinterpret something that is not as dangerous as something that's very dangerous, or vice versa. Something very dangerous as, oh, it's nothing. So we're trying to find a balance here. Any questions about that in particular? I feel like that could be a tricky conversation. Okay. So pain becomes overactive when we don't have support. A big part of learning how to start to lower the fear in your body about the pain that you're having actually has nothing to do. It can have something to do with the pain and have nothing to do with it as well. Because we need emotional support, we need social support, logistical, even financial, having the finances to be able to see different specialists or take the time off work or do what you have to do to make it to these appointments. All of these things play a factor. I'm sure someone out there can create a beautiful Venn diagram of what that would look like. But the main concept takeaway here is that when we don't have proper support, pain can become really overactive. So even if we don't have necessarily the right financial support or the right social support, maybe we have some emotional support that does help us stay grounded. And maybe that's what gets us through in the challenges in the other areas, finding the social support, finding the financial support, the medical support. If we have something that can anchor us and hold us here, it then helps us be able to work through some of the struggles in the other areas. Emily, can you say a little bit more? You said, what do you think of the mind-body syndrome related to that? There's a lot of mind-body syndromes, and I want to make sure we're on the same page with our language. So just maybe elaborate if you're talking about a specific illness, or if that is, if it's more general, and I'll look back at that in a minute. So one of the things that we can start to do that's really simple, and it's not some kind of overnight cure, but it is a simple practice to add into our daily routine, is to have a reflective practice. So we want to start asking ourselves what our pain experience is like. So our pain experience is the emotions that come along with a certain sensation. Your pain might look totally different than someone else's. So some examples would be a constant stomach pain or joint achiness, shooting joint pains, migraines, headaches, other musculoskeletal type pain or nerve pain. We want to be able to ask ourselves, like, what is this pain experience like? Usually at the start of this journey, it sounds just a lot like, everything hurts. That's a common one. Everything hurts. And what we're looking for when we start to have a reflective practice is what specifically hurts. And it literally does feel like your whole body is in pain. But when you start to find little bits and pieces of the body that aren't in pain, for example, joint pain was a hallmark of what I used to experience a lot. Thankfully, that's gone down a lot. And it would feel like my entire body was on fire and every joint in my body was hurting. Through this work, as I start to know, I would notice, okay, well, there are two joints, that I'm thinking of now, my knee and my ankle. And then I even had a lot of nerve pain along my shins. So it's like there's pain in the joints. There's the shin bone, which is connecting more pain. It's right. Then if I would think back to my calves, okay, there actually isn't pain right now in my calf. So I'm looking at areas of the body that don't have pain, not because I'm trying to be overly positive or like not focus on my pain, but because I'm trying to balance out, kind of like that conversation at the restaurant that we talked about. We don't want them too close. We don't want them too far. And that's what we want to do with our pain. So by asking ourselves daily, what is this pain experience like? We get more and more and more familiar with these sensations. So again, at first it'd be like my whole body hurts. And then I'd be like, wait, okay, my knee hurts, my ankle hurts, my shin hurts, but my calf doesn't. So I'm just getting more specific here, which actually brings a level of safety into my nervous system. Emily, I don't know Dr. Schubiner, but rebuilding new neural pathways is basically what we're covering here. And I think neural pathways is like a really fancy kind of term that sounds, it's a true term. Like we are rebuilding neural pathways. Basically what that means is like, we are hardwired evolutionarily. We are hardwired to seek out or to see danger so we can stay alive. And in our modern society, there are so many opportunities for our brain to say danger. Even just the way I'm sitting right now in this chair, it's not a natural position. I won't go too much into the body stuff because that's not my scope of practice, but it's a lot of what we do just isn't natural and normal for the body and how the body mechanics work. So that sends some danger signals to our brain. And by doing what I'm doing here, where I'm encouraging us to seek out moments of safety, we are firing up the safety neural pathways in our brain, allowing them to work more, light up longer. And that's a muscle we have to build. It's actually a neural pathway, but for example, it's like a muscle that we have to build. And so I do believe, so all pain, all physical and emotional pain is connected. One doesn't necessarily cause the other. That's a big misconception, I think, right now about trauma causing chronic pain. It's just so much more complex than that. And maybe one day I'll do a workshop like specifically around that. But if anything I said there brought up a new question for you, then feel free to interject and type out a new question there. So in this daily reflective practice, we want to ask ourselves what the pain experience is like. And I'll go over this list with you all in just a moment, which will help with that. How do I verbally and non-verbally express pain? Like, how do you communicate pain to the people around you? Sometimes we are very verbal about it. Maybe this even everyone around us they're tired of us complaining. So that's how they view it. So are we talking about it nonstop? Or are we not talking about it at all? And also maybe what are some of the nonverbals, like grimacing? Do you grimace or brace your body every time you're in pain? Again, by asking this question of how do we communicate pain, we're not even talking about what you should do or what you shouldn't be doing. We're just asking the question, how? How do I verbally and non-verbally express pain to my loved ones, to my doctors, to the people around me? And we just reflect on that. This is a daily practice here. And the more you ask these questions, the more specific you're going to be able to get and the more intuitive you're going to be able to get about your pain. Another reflective practice question is to ask yourself, how long did this experience last? So for example, with my joint pain, it would be sometimes all day. But again, when I really started to pay attention, I would notice, oh wait, I had this moment where it was gone and now it's back. And it's gone and it's back. So I started to realize, like, okay, it's not all day long. It's a good portion of the day, but there are moments of relief. And that moments of relief started to get me curious about my body's ability to feel relief, which I didn't think was previously possible. And then this is 3 twice, but number 4 is, can I pinpoint anything that made it worse or better? Again, since this is a reflective practice, be really careful here not to say, what made it worse? What made it worse? What made it worse? What made it better? What made it better? What made it better? With this anxious energy of, I got to know the root cause. I got to know exactly what I did and then never do that thing again. Because pain is a bucket that gets, the things that cause pain is typically more than just one thing. It's usually a stress mixed with a physical thing that might have happened, maybe an environmental thing if you're sensitive to smells or you ate something. But it's usually multiple things at once that kind of fill up this bucket before you experience that sensation of pain. So when we start to analyze like this one thing, this one root cause, we can get really tripped up on that and start cutting things out of our life, like foods we love, or people we actually love, or places we love, because we've now associated that one thing with the pain. And we really have to think about this a little more holistically and realize the benefits that we gain from those things that we love, and how whatever the benefit is in those things brings a level of safety to us, even if there's also a level of non-safety or pain. So we want to ask these 4 questions every day. And again, the purpose of asking the question is to build your intuition. And as you build your intuition, you'll be able to answer some of these questions a lot better for yourself and for your doctors who are asking you questions that are often really hard to answer. Fear reduces when it feels seen, soothed, secure, and heard. Let me see if I can zoom in here. Yes. When we're talking about feeling our pain, some things to consider are, these are just sensation words. So sometimes it's hard to label things. In the workbook that I'm going to send out by Sunday, it will have this list in there, so don't feel like you have to write it down. So for example, my joint pain was often achy, but I also had a stabbing pain in my joints. And that was learned later on, kind of a hallmark of, not a hallmark, not everyone experiences this, but it co-occurs with Lyme's disease a lot. So that was, that word's not even, I don't think it's even on here. Stabby was a word that I used often. And again, the point of using these words is not like you bring this to your doctor and you say, I feel a stabby pain, tell me what it is, and then let's fix it. It's not about that, because your stabby pain might mean something totally different than mine. And that's important to remember. We are really so individual. The goal of this practice here with labeling is about helping your pain feel seen, soothed, secure, and heard, which inherently makes us feel safer and reduces fear. So we want to observe our pain, notice it without judgment, and allow it to be there. It is going to be there whether we like it or not. And so if we ignore it, again, it increases that fear. And it's like listening to that conversation where the couple is way, way, way far from you and you think someone's angry when they're not, or way, way, way too close to you. And same thing, like we misinterpret the signals. I want to invite you to question yourselves. What sensation on this list, again, you don't have to do it quite right now, and this will be in the workbook, but what of these are easiest to be with? And which ones are hardest? You know, like in fibromyalgia, you might have a lot of tender points. I mentioned earlier how my shin would hurt in between my knees and my ankle. The knees would feel achy. The shin always felt really tender. And for me, that tenderness was way harder than the achiness. I was kind of used to the achiness. It was like every time I walked, I felt it. Whereas the tenderness on my shin, I'd only really feel if I touched it. And that was a really hard sensation for me to be with. Same thing with like headaches. You know, you could have stabbing headaches, or you can have, which I used to get those as well, or you could have really a lot of pressure in your head or pounding. We can also feel kind of disconnected from our body, and sometimes that actually feels good because we're disconnected and we're not feeling the pain. And other times that feels really jarring and disorienting. We don't like it. So just observe, notice, allow. Consider the question, how much time and awareness do you give these sensations? Because we want to start to learn how to have an appropriate amount of time with it. We don't want to give it all of our time and energy, but we don't want to give it none either, because it's really, really desperately trying to feel seen, soothed, secure, and heard. Another comes up a lot are adaptations to certain exercises, or needing accommodations at work, or even for yourself in the kitchen or whatnot. You might need tools like scissors instead of a knife, or using the anti-fatigue mats in your kitchen, or needing to stand up while you're working or sit down differently than the way that others might, we were taught to do in K through 12. Sit down still at a desk and don't complain about it, which is just, our bodies don't work that way. We want to make sure we're having compassion for ourselves and for everyone else around us, as appropriate. We want to have boundaries with that as well, but that's probably a conversation for another time. Keeping in mind that all emotions deserve time, space, and acknowledgement. Again, this is how we move through them, by giving them time and space. A lot of people struggle with this because as soon as we feel an emotion, we typically then have a very reactive behavior with that emotion. Angry means I yell, or angry means I lash out in a different way, like I stop talking to people I love, or I do something very instinctively. And so we want to just give a time and space to the anger, but learning the skills it requires to feel what we're feeling and then not do the thing that is not aligned with our values. So if you really love your partner, but your pain makes you angry, and then that anger makes you lash out, at the smallest thing that they've done, we're just wanting to recognize over and over and over again, what's filling my pain bucket? Like, where's my tolerance level at? What makes me lash out? And doing all of this without criticism of ourselves. We can observe and collect data without criticizing. And that's how we can make change there too. And it's how we get better at asking other people to change as well. We can't ask them to change and just expect them to, but making that request is sometimes a really important part of relationships. So another Another thing is if you only notice your pain when you're at a level 10, like, okay, I pushed through all day. Now I'm at the point where I have to crash. I cannot do another thing. I have to go lay down. I have to get the ice packs and the heating packs, and I have to, we're debilitated at that point. If we only notice our pain when it's at that level, what ends up happening is your body starts to send you signals that you're in pain quicker and quicker and quicker. So we're actually physically reducing our ability to last longer by only noticing it when it's at that level. So when we're first starting to work with this, we work backwards, and we notice that's kind of what I was describing here and why it's so important too. What does a level 10 feel like? I'm not trying to fix it. I'm just trying to observe it. Once you get really good at that, you're going to be able to get really good at understanding what a level 7 feels like, and a level 5 and a level 2. And you're also going to be able to get really good at knowing what you need when you're in those lower levels. Essentially, this is a mindfulness practice. Mindfulness is not just meditation where you're trying to clear your thoughts away. I think that's a really common misconception, but mindfulness is all it is paying attention to what's happening in the present moment without judgment. There are different types of mindfulness and meditations and all of that, and you can add those practices into your life. Those are wonderful practices for calming yourself, for anxiety reduction, for all of that. But initially, you don't have to worry about any of that. You don't have to worry about sitting down for a 10-minute meditation and having no thoughts. Like, really, all we want to learn to do is pay attention to the present moment without judgment. And also keep in mind too, I know there's so many mindfulness and meditation apps and Instagram, social media education around it. We really are, like, humans are meant to be communal creatures. We thrive in community. And so if you're trying to do everything alone, whether it's mindfulness or your PT exercises or other habits, you might not have an option. Like, doing these things alone might be the only option, but just know that if it's really, really, really hard for you, adding someone into that practice might be the thing that actually helps you get there, because it brings in that community aspect, and that's really where we thrive. That's, again, an individual. You have to figure out, when do you feel most motivated? Is it when you've got one person by your side and you're both doing the same thing? Is it when you're in a group of 10 or 20 people? Like, everyone has different levels of extroversion. So keep that in mind. If again, PT is like a really common one. It's like, I think PTs get the most, like, they have the hardest job, because they send us home every week with exercises, and we come back and we're like, yeah, no, I didn't do it. But that's because they're sending us home alone to do these exercises alone in a very, like, non-natural environment. So again, it's not about fault or blame. It's just, can we notice what's happening here? And eventually the answers of how to change are going to come, but we have to be able to sit with it first. Okay, so an observation exercise, and I call it observation exercise. Some people would still call this mindfulness, but again, it's not about all of the misconceptions I've already talked about. It's just about learning to observe what's happening in the present moment. So I would encourage you to, if you feel comfortable, write in the chat, what are some of the current observation exercises that you already engage in? Do you practice some kind of mindfulness routine, or do you practice pausing throughout your day, or breath work, or anything like that? Just let me know if you do in the chat. I'll give it a minute. Body scan meditations, I really like those. I couldn't do body scan at first. It had to be, for me, it was specifically progressive muscle relaxation. I guess I needed to be told something to do. I couldn't just, like, think in my head, okay, what do I feel here? What do I feel here? What do I feel here? So that's just an example of how we sometimes certain things don't work for us. We have to meet ourselves where we're at. And then eventually now I can do a body scan. No problem. John, examine. I actually don't know what that is. If you want to add anything to that, EXAMEN. Going outside into nature and observing things around me to ground myself, and guided meditation on Insight Timer. Yes, I really like Insight Timer. And just, yeah, being around nature is always really soothing. Curable app. I never really got into that app, but I've heard really good things about it. Do they have meditations on the Curable app, or is it, I think it's like pain education, is that right? It says, I don't really practice observation of my pain, but I've applied this idea to my emotions, which has helped sometimes. Absolutely. Yeah. So that's a big part. Like, if you've been in therapy or you've been doing this work mentally, you're going to be able to then bring that practice into working with your pain too. And it is the emotional and the physical are so connected that the same things that work for emotional pain will often work with your physical pain too, even though there's a physical component that's also, like an illness or an injury or something like that, that's contributing to that physical pain. Awesome. So, all right, let's get into, the next part of this is going to be about your medical team. This in and of itself could probably be a whole other workshop, so I'm going to keep this really short. There's a lot more of this in the workbook that you'll get by Sunday. Your medical team should be clarifying in your conversations, remembering that they're human. Okay, so they're human, they're not perfect, but they also should not make you feel shitty. And your medical team should clarify. So they should ask clarifying questions. They shouldn't just assume. A lot of times that is what makes us feel so dismissed, is like we say something and they almost don't respond, or they just say something totally off the wall different. And you're like, what, did you even hear me? And so they should be asking clarifying questions when they don't understand. And you should be doing the same with them as well. They should be providing you with next steps. Even if they don't know what those next steps are, they should at least be saying, like, we don't know, but here's what we're going to try to do. They should be explaining more when you're asking them to, and making appropriate referrals. If they don't know something, it's not in their scope or their area of expertise, they should absolutely be making appropriate referrals. And ideally, they should have experience in your condition. This isn't always going to happen with the first practitioner that you go see. A lot of times, most of us end up seeking people out who do have experience in our condition. They should always be looking at things from a multi-pronged approach, just meaning like they shouldn't have just one tool and they think that that's what you need to do. They should be open to trying multiple things. They also should be asking about your support network and making appropriate therapy referrals, not just like, this is all in your head, you need to go see a therapist and stop coming to see me. It should sound more like, this is really hard. We don't have a lot of answers for you. In the meantime, a therapist can really help with the struggles that comes along with living with a chronic illness, especially one that people don't have a lot of answers for. Okay. Yeah, so they should not be telling you it's all in your head or it's just anxiety. They shouldn't be making a therapy referral in lieu of other medical referrals and assessments. It shouldn't just be therapy and nothing else. Shouldn't be rude to you, and they should not tell you to just lose weight. They just shouldn't. If they do ask about your weight or talk, like if that's all they want to talk about, I encourage you to ask them what improvement markers they'll be looking for in your blood work. Because improvement markers in your blood work, whether that's cholesterol or whatever it is. I'm not a doctor. I won't pretend to go into all that. But if like standing on a scale and showing that you lost 20 pounds doesn't do anything for your cancer, it doesn't do anything for lupus, it doesn't do anything for a lot of times even PCOS, which is a big one where people are just told to lose weight. So you want to kind of challenge them there. If they're talking to you about your weight, you want to ask them, okay, all right, fine. I'll lose weight. Maybe you don't have to lose weight. But my point is, okay, fine. But if I do, how are you going to know I'm healthy now? Other than just that the scale says I'm 20 pounds lighter. Things that are really hard when it comes to cultivating a medical team is considering who's in network with your insurance versus private pay and how much finances you have, and also want to spend on this. That's an important part. And so the financial conversation is a whole other broad topic, but it's important to know part of it is going to be physical, like logistically, how much money you have. But there's also a component of how much money you want to spend. And that also comes back to, if I'm spending X amount, does that make me feel unsafe? Even if am making enough to cover it, is there a safety aspect in spending this money? A lack of safety. On the flip side, for some people, spending their money in this area, like that is what makes them feel safe. So they might actually even spend more and more and more money on treatments and on extra things because it makes them feel safe. And so that's where those individual differences come in again. And that's why this takes such a reflective, individualized process. Also, things to consider is like, how far away from home is the specialist? Do you have to travel to see them? How often do you have to see this kind of specialist? Are they someone you have to see once a week, once a month, once a year? And then investment mindset, that's kind of what I was already talking about. And then just considering who should even be on your team. What kind of specialists do you need? Your general practitioner should be helping guide that conversation. Some are better than others. But these are questions we're asking ourselves in order to then make the best decision that's right for us. Generally, you want to have a general practitioner, specialists, if that aligns with your values, and if it aligns with your particular condition. Holistic practitioners, again, if it aligns with your values and if that brings a level of safety to you. And movement specialists are often really important. So that's either personal training or physical therapy, or really qualified yoga therapist or yoga teacher. Those are two different things. Yeah, what would you all add? Might add that into the chat. What obstacles do you have to navigate when it comes to figuring out who should be on your team, and what other types of specialists or doctors you might have? So some more on the whole money conversation. Just I kind of was trying to be funny here, but it's your money and you can cry if you want to. When it comes to choosing to like how to spend your money, again, sometimes it's a choice, sometimes it's not, but we still have to ask ourselves, how does it feel to spend this money on this treatment? And what would make me feel more comfortable spending this money on this treatment? What am I hoping to gain from this treatment that would make all this money spending worth it? And you can think a little bit like fantasy world, like you can think in that way. Sometimes it's helpful to just allow yourself to be like I live completely pain-free all the time, 100%. Like no one ever lives pain-free 100% of the time, but in your fantasy version of trying to answer this question for yourself, you're allowed to say that. And then when we bring it into our reality, okay, well, what's realistic for me? What do I actually think I can gain from medicine? And then if I gain that from these treatments, do I feel that it was money worth spent? Yeah, Emily, a lot of people do not know about EDS. it's very sad. More and more are learning about it, but just not nearly enough. And then there's so many different types too, and they just don't know enough. And then Wendy, yeah, it is hard to find a general practitioner with insurance. Yes, that's the hard part about this. So some of the things we consider here is choosing the most important members. You know, the other thing too, I mean, I've gone without a general practitioner for many, many years, but I do a lot of that legwork of having all my, like, knowing what treatments I've had, or you know, like keeping track of it all for myself. And so you can decide maybe that you don't need a general practitioner. It's individual for all of us. And when you're thinking about the money, I encourage you to pause and notice what this money is giving you or allowing you to do, rather than just the thought of losing the money. Like, I'm losing money, I'm bleeding money, it might even be true that that is what's happening. So it's not about dismissing yourself in that reality. It's again about finding moments of safety. So yes, I'm bleeding money here. What is that giving me? Why am I spending my money there? If the reason that the answer to that, if the reason is good enough, like you trust and believe that even though it's expensive and you hate it, it is truly giving you what you need, it becomes worth it. But if you don't, then it might not be worth it. It might be time to stop spending money in that area. Our system is really flawed. There's just no doubt about that. We pay a lot of money in insurance to then go through procedures that cost us more money. So I wrote here lobby for change, but that even feels just like a bit futile. And I don't have the answers for how to create change, but we can also start asking that question together. How do we create change in this area? What needs to change? And then how do we make that happen? Again, I don't have the answer, but I do ask that question because I know that asking the question brings about change later on. So I think it's important. You also don't need all the treatments all the time. So when you're thinking about what money you want to spend, I don't encourage you to kind of just erratically be like, this month I'm spending this month I'm spending that, and then I'm taking this away, I'm taking away, like with a fear-based mentality. But you might say, for the next 6 months, I'm focusing on PT. I'm going to pay out of pocket for a really good specialist. And that's what I'm going to do. And that means I'm letting go of like something else. Of course, if it's like medications that are expensive that you need for your daily to live, that's a non-negotiable that just stays all the time. But if it's something that is more of like a, you know, like PT, I mean, with EDS, that tends to be a non-negotiable, but lots of people still go without it. And so you have to ask yourself, is there something else that's more important than PT this month or for the next few months that I can focus on? Because my money and finances is forcing me to make that choice. And I also really encourage you, while you're working with a provider, to write down all the things you're looking for from them. And when you're done working with them, revisit this list often. So when I do PT, I'll often have my physical therapist video me doing what it is she's telling me to do. So I have those videos so that when it's time to choose to spend my money elsewhere, I have something to look back on. So that's it. That's the end of today's presentation with how to stop fearing your body. Again, this is very, very introductory. It's just meant to get you curious, to get your wheels spinning, and to help you start asking yourself really hard questions and being with really hard things like emotions and sensations. The workbook will be coming by Sunday. I would be so appreciative if you filled out, I'm going to send you a feedback form with it, because the feedback form is going to help me make better workshops for you all. And that feedback really, really does help me, even if it's negative. So please feel free. And before you go, if you're open to writing down any key takeaways, or if you want me to go back to a slide, that I was on and talk about something, I have more time, write that in the chat. I'll wait a few minutes and see what comes up for you all. Thank you, Faith. Was there something in particular you can point out that felt most helpful? And it's okay if not. That makes sense. Yes, Wendy, I can go back to the first few slides. These were kind of the objectives, and I'll kind of go through. Someone said, I've never thought of building a feeling of safety in that way. Yeah. How can you build a social support network? I struggle with that. Yeah, that's a really tough one. I have a lot to say on that. I'll kind of give you the keynotes, the main points around that, which are, one, always, we want to think about building relationships less about it fulfilling a need for us and more about how the relationship works together. Once we're sick, once we're really in a lot of pain and we're in that fear-based state where like everything feels really scary, we are in a state of survival, and it is really hard to think about anything other than what our needs are. I need this, I need that, while also feeling like you're not allowed to need anything and feeling like a burden. So we want to find, one, we want to start being intentional about who is in our circle and what they're actually capable of. So that requires us to know what our needs are. It also requires us to know who is capable of giving us that need. We might need a lot of emotional support, and we might be married, and that partner might have no capacity for giving us that emotional support. And if we keep reaching to them for the emotional support, what's going to happen is it's reinforcing the idea that we're not lovable, we're a burden, we're too much, we're not allowed to ask for help, we're not allowed to be emotionally vulnerable, because we're asking a person who can't give us what we need. And then we're blaming ourselves and saying, you know, it's our fault, we're broken. When in reality, or like a certain friend, you know, you might have a friend that you vent to all the time, and maybe they're tired of hearing it. And then again, we feel like we're the problem. To me, that means that friend's they don't have the capacity for holding what you're bringing to them. So this is more of that reflective practice. Who in my circle is capable of what? And what needs do I have? So who can fulfill those? And then also what's really important is, what needs do I fulfill for others? We want to be careful not to, a lot of us are caretakers in the sense that we overgive for everyone, and then we have no ability to ask for what we need. There's that guilt that happens there. We really want to make sure it's reciprocal. We're not overgiving and we're not undergiving. So where can you give less, if that's the case, if you're an overgiver? Because that will actually help your relationship to do less in those cases. And then where can we do more, where we need to do more in a way that doesn't abandon ourselves. But I do plan on doing some workshops just around that idea too. So we can go into that for sure. Yeah, we don't need all the treatments all the time. And evaluating providers. The workbook is going to have a little chart where I go through it a little bit more. I can share with you. I worked really hard on this page, so I'm a little bit proud of it. But I can show you I call it your medical team audit. let me stop sharing here and then share here. So you'll get this workbook again by Sunday, and your medical team and why they matter. Whose job is what? So I have a little Venn diagram here for like what your roles are in your medical care and what your medical team's roles are. And you can add to this as my goal in all these things is to get you thinking what works for me, what doesn't work for me. And so I've added some examples here, but then you get to add in more. Your medical team audit. So their name, their specialty, their purpose on your team, like why do you even see them? Their shortcomings, what you like, what you don't like about them, and also what they do well. So what you do like about them, and your average costs with them. There's somebody that you see monthly. The reason I didn't put like your monthly costs is because some of our doctors we see once a year, once a quarter. So you can kind of put like X amount per month here, or X amount per year. You can change that to suit your needs there. And then again, does the cost feel worth it for what you gain? You can write some notes that come up here, and then there's some more journaling and reflective questions here to help guide you in that. And to iPhone user, if you are on my email list, then you'll get future updates about future webinars. If you got this link somehow through a friend or something, just send me an email, destiny@destinywinters.com. If you want to make sure that you're on my list. But if you are on my list and you know you are, then you will get those. I'll send them out every month. And then Faith asked you have any books or other educational resources? Oh, and I missed that suggestion, Emily, gone to Chronic Pain Anonymous for social support. Cool. That I don't know about that resource, so I'll have to look into that. Chronic Pain Anonymous. And books and educational resources. So I have a podcast. If you guys listen to that, if you don't listen to that already, it's the Chronic Illness Therapist podcast. It is much more about like the emotional support, building relationships, managing pain emotionally, all of that. Let me think what some of my favorite books are. I do like the book The Way Out. Let me try to remember who the author is. What I will say about this book, Alan Gordon, is that so it's pain reprocessing therapy, which is very cognitively behavioral. It's cognitive behavioral science, which for some people is great and that works wonders. It never worked for me. I don't love trying to think my way out of pain. But he's not totally cognitive behavioral. He does add some somatic work into that. So everything that I would recommend, just make sure as you're reading it, you're also filtering it through your own lens, asking yourself questions, being really not taking anyone's word for gold, even mine, and really figuring out what works best for you. So The Way Out is a book that can be helpful. I'm trying to think of what else is good for a lot of my learning comes from I'm trained in somatic experiencing, which is for practitioners. It's like a 3-year body-based program. So a lot of my learning just comes from like those kind of training. So I think in time, I'm going to try to get a resource list together for people. And again, if you're on my email list, I'll just send that out. But I think that that's a good place to start. I'm zooming chronicpainanonymous.com. Awesome. That's a good resource. Any other questions come up? I so appreciate you guys interacting and engaging. It helps a lot. Okay. If that is it, if we don't have any more questions, I'm gonna let you all go. I'm gonna go as well. And again, you'll get this workbook by Sunday. So thanks all for joining, and I'll see you at the next one.